If you've been struggling with heart palpitations, anxiety, and high blood pressure, you've probably asked yourself, why did this happen to me? I used to be fine. Hi, I'm Juliet with Salus, and after working with hundreds of clients through our Calm Heart method, I've noticed some very clear patterns in what triggers heart-brain dysregulation. Today, I'm going to cover the most common patterns, things like chronic burnout from extended work stress, viral trigger events like post-COVID symptoms, or substance-induced panic attacks. Also, things like hormonal shifts from perimenopause or adverse reactions to medications or peptides. And lastly, the role that things like trauma from witnessing medical emergencies or losing a loved one can play. Understanding where your symptoms come from is the first step towards reversing them. So as I go through these, I want you to ask yourself, does any of this sound familiar? Because if it does, you're not alone. And more importantly, there's a clear path forward. Before we dive in, it's important to understand that while the first panic attack or symptoms might feel like they came out of nowhere, heart-brain dysregulation typically develops through one or two scenarios. First, there's the straw that broke the camel's back situation, where someone has been managing chronic stress for years, and then one event pushes their nervous system over the edge into a state that it can't recover with on its own. Or second, there's a significant trigger event that shocks the nervous system so severely that it gets stuck in a state of hypervigilance and fight or flight, even long after the original event has passed. In both cases, what happens is that your autonomic nervous system, your HPA axis, and your heart-brain communication pathways become dysregulated. Your body essentially gets stuck in a stress response and it can't turn it off. Let me walk you through the most common causes that we see. And I want you to notice if any of these resonate with your own experience. The overflowing stress bucket. So the first and most common pattern that we see is what we call the overflowing stress bucket. This typically affects successful business professionals, healthcare workers, and family providers in their 30s to 60s. People who have built impressive careers and lives, but suddenly they find themselves unable to manage stress the way that they once did. The pattern. You've been handling intense demands for months or years. Maybe you're working 60 to 7-hour weeks, managing a demanding business or dealing with high pressure deadlines. Now, on the outside, everything looks perfect. A successful career, family, the life that you worked so hard to build. But internally, stress has been accumulating without ever fully being processed. And then one day, seemingly out of nowhere, you have your first panic attack, or you notice that your heart is racing at night, or your blood pressure spikes for no apparent reason. And from that point forward, you can't seem to get back into your baseline. The combined stressors. Often, it's not just one thing. It's work stress plus a divorce or a relationship strain, plus a financial problem or pressure, plus poor sleep. Each stress on the individual might be manageable, but together they overflow your stress bucket. Your nervous system essentially runs out of capacity to self-regulate. And what's particularly frustrating for this group is that you're used to thrive under pressure. You might have even prided yourself on handling stress well, and now you feel like a shadow of your former self. And that identity shift from confident provider to someone who can't even drive without anxiety, that becomes part of the cycle itself. Category 2, trigger events. So the second major category involves specific trigger events that shock your nervous system into a state of dysregulation. That's substance-induced panic. This is incredibly common. Someone uses THC or marijuana maybe for the first time, or maybe after years of using it without an issue, and has an intense panic attack. Their heart races and they feel like they're dying, and the experience is so terrifying that their nervous system essentially gets stuck in that fear state. Now, even though that the substance has long left their body, they continue to experience palpitations, anxiety, and hypervigilance about their heart. We've heard countless variations of this, like, I smoked once and had a panic attack and I haven't felt the same since. We see similar patterns with other substances. A bad reaction to a pre-workout supplement, too much caffeine, or even prescribed medications that triggered an unexpected response, post-viral and illness-related. COVID and post-COVID has become major triggers that we see. Like, many people develop heart palpitations, shortness of breath, and anxiety during or after their COVID infection that never fully resolved. But what we also see with this and other viral infections, Epstein-Barr virus, Lyme disease, or even severe cases of the flu. Now, these infections can trigger inflammatory responses that affect nervous system function and create lasting heart-brain dysregulation. Medical procedures and surgeries. This is a pattern that often gets overlooked. Someone has a surgery, maybe gallbladder removal or a hysterectomy, even a dental procedure. And during the recovery period, they develop anxiety and heart symptoms that persist long after healing. The combination of anesthesia, the physical stress of the surgery, pain medications, and the trauma of the medical experience itself can trigger the nervous system response that doesn't resolve on its own. We've had clients who trace their symptoms back to a specific surgery or a medical procedure years earlier. Injuries and concussions. Head injuries and concussions can directly affect the autonomic nervous system and create lasting dysregulation. People don't realize that post-concussion syndrome often includes heart palpitations, anxiety, and dysautonomia as core symptoms. Category 3, hormonal and physiological shifts. The third category involves hormonal changes and physiological stressors that disrupt the nervous system balance. Pregnancy and postpartum. Pregnancy creates massive hormonal shifts, and for some women, their body never fully rebalances afterwards. They might develop postpartum anxiety, heart palpitations, or a sense that my body just hasn't bounced back. The dramatic hormone changes during pregnancy and the stress of new parenting can overwhelm the nervous system and its ability to regulate. Perimenopause and menopause. This is just another huge category. As estrogen levels fluctuate and eventually decline, many women suddenly develop heart palpitations, night sweats, panic attacks, and anxiety that they've never experienced before. The hormonal shifts directly affect the autonomic nervous system function and stress hormone regulation. Male hormone issues. For men, we see patterns related to declining testosterone or poorly managed testosterone replacement therapy. Low testosterone can increase anxiety and affect autonomic regulation, while poorly dosed TRT can create similar issues. We're also seeing more people who have had negative reactions to GLP-1 medications like Ozempic or Wegovy, peptides, or either other hormone therapies. These compounds can alter your body's natural hormone balance and stress response in ways that trigger lasting dysregulation. The key with all of these is that hormonal changes don't just affect your mood. They directly impact your autonomic nervous system, your stress hormone production, and your heart-brain communication. Category 4, trauma-based patterns. The fourth category involves traumatic experiences that create lasting nervous system hypervigilance. Maybe witnessing medical emergencies. Many of our clients describe witnessing a family member have a heart attack or a medical emergency. Maybe you watched your father collapse, or you're with a loved one during a health crisis. From that point forward, your brain associated heart symptoms with mortal danger, and you became hypervigilant about your own heart. Loss and grief. The loss of a loved one, particularly to a sudden heart-related death can create profound anxiety about your own mortality and health. The grief response itself is physiological stressful and can trigger lasting nervous system changes, PTSD, and complex trauma. Now, for those with PTSD from military service, accidents, assault, or other traumatic experiences, the baseline state of nervous system hypervigilance creates vulnerability to heart-brain dysregulation. The same mechanisms that create PTSD, an overactive amygdala, dysregulated stress response, heightened threat detection, also create the perfect conditions for cardiophobia and heart-related anxiety. Now, sometimes the roots go back even further. Growing up in a household with significant stress or instability or health anxiety can prime your nervous system to be more reactive. You might have developed hypervigilance as a survival mechanism that's now manifesting as heart-related anxiety in adulthood. Now, as you've been listening to these categories, you might have recognized yourself in multiple patterns. That's completely normal. In fact, it's very common. You might have been managing work stress for years and then had a bad reaction to a medication, which triggered your first panic attack, which then led to developing travel anxiety, or maybe you went through perimenopause while dealing with a family health crisis. And those combined stressors overwhelmed your nervous. The key insight is this: these aren't random, unexplainable symptoms. They are clear patterns and causes behind heart-brain dysregulation. And more importantly, understanding what caused your dysregulation helps us know exactly how to reverse it. Your symptoms aren't just anxiety or all in your head. They're legitimate physiological responses to real stressors that pushed your nervous system beyond its capacity to self-regulate. If you recognize yourself in any of these patterns, and especially if you recognize yourself in multiple categories, I encourage you to schedule a consultation. Make a call with our team. And during this call, we'll identify which specific causes and patterns are driving your symptoms and create a personalized roadmap showing exactly how we would address them. And this roadmap is yours to keep regardless of whether we work together. The link is in the description below. You can also watch our video on how the Calm Heart Method actually reverses the heart-brain dysregulation, which I'll link in the description as well. Understanding where your symptoms come from is the first step. The next step is learning how to reverse the dysregulation and reclaim your health. We look forward to helping you do exactly that. Thank you for watching.